Hi, everyone. I'm Denise O'Malley, the founder of You Define Wellness, and welcome to another webinar on our Apple a Day series. These are the series that we've been doing, introducing you to wellness professionals within the You Define Wellness Network to share tips and tricks and things to help you live a happier, healthier life. Today, it is my pleasure to have a conversation and introduce you to Dr. Brett Courtright, a doctor of pharmacy. Brett, good to see you, and thank you for being on the call today.
Thank you for having me, Denise. I really appreciate it.
So I have to ask, Brett, did I get your title right?
You did. Thank you for getting it right. I get a lot of time. You'd be surprised at the different degrees I have, depending on who you talk to. It's PhD in pharmacology, PhD in pharmaceutics. Doctor of pharmacy is correct. Good job.
Oh, good. You know, you are the first pharmacist that we have in the You Define Wellness Network, and I'm a reformed insurance agent, so I don't always know these things.
I'm a reformed pharmacist, so it's okay.
And that's what's going to be really exciting about this conversation is that you are a reformed pharmacist.
Absolutely.
But let's start off with this. Why did you choose to become a pharmacist?
That is an excellent question. I started working in the pharmacy field, particularly when I was 16 years old. I was a pharmacy technician in my hometown of Memphis, Missouri. And I'll be honest, I took the job because it was a job that paid $10 an hour, and that was amazing. So, but then I got to see a little bit more about what the field of pharmacy was like from a retail pharmacy standpoint. For about a year or so, I thought that was the route that I wanted to go. And then I moved over to working in another pharmacy and got to see a little bit more of the education and just some different things that pharmacists were able to offer outside of just dispensing medications. And that sparked my brain a lot more to want to pursue the field. And so then when I graduated from high school, I moved to Kansas City, went to pharmacy school, and all throughout my time in school, I knew I wanted to get a doctor of pharmacy, but I never seemed to find an actual modality of pharmacy practice that really spoke to me. I knew I didn't want to do retail. I'd kind of grown out of that phase. I did some work in a hospital, and I enjoy it, and I still do that from time to time, but that wasn't it either. And so I navigated through school trying to figure out, why do I want to be a pharmacist? Mm-hmm. And towards probably my next to last year of school, I realized that just because you go to pharmacy school doesn't necessarily mean you have to be a traditional pharmacist. You can be a reformed pharmacist.
Oh, okay. So I've never heard of that before talking to you. So I know the next place you're going to go with this is, what does that mean to be a reformed pharmacist? So let's explore that a little bit.
Sure. Well, I'd like to start by saying being a regular pharmacist is very respectable. There are lots of, so as reformed not being in a negative term, but to be a reformed pharmacist, in my opinion, just means identifying that you have a degree. So those of us that go and get a bachelor's in biology can do a number of things with that. You don't have to go into one field. And so that's what I discovered towards the end of my schooling, was that I was actually not just getting a license to be a pharmacist, I was getting a degree. And I started the knowledge that I had gained in pathophysiology, anatomy, physiology, pharmacology, all of these different things that I had learned that I could use to educate other people. And so that is where the beginning of the reformed pharmacist came, is that I realized that I could do something that didn't necessarily require me to be what everyone knows a licensed pharmacist to do.
Okay. So you have just recently opened your own business called HiQ Health Solutions. Do I have that right?
It's HiQ Health Solutions.
Oh,
yes.
HiQ.
HiQ.
Okay.
Yep. It's like your I want to make your IQ high in health.
Okay.
and
Now,
we're your solution for that.
as opposed to the haiku.
Yeah, that's
Okay.
right. Yeah.
So,
No poems.
yeah, no poems there. So, in this role as a consultant in helping people, how do you help people?
That is another beautiful question. The beauty of the degree that I have is that I can do that in so many ways. And educate clients in regards to any health problems that they have.
Mm-hmm.
If you're diabetic, what does that mean? We know that means your blood sugar's off, but what are the details about what that means? In addition to that, I can expound upon the treatments that they're receiving, both medication and also lifestyle changes, because we learn quite a bit about both in school. In school, we have to be able to treat a patient both, to know the treatment for a patient through pharmaceutics, but also how to help them make lifestyle changes as well. So through putting all that together, I'm able to help individuals understand a vast number of things about their health care that they may not get when they go and get a 10-minute appointment with their doctor. So if you're not understanding your labs, if you're not really understanding what the disease is you have, if you don't understand what medications you're taking, I can help you with that. I can also help you understand what types of lifestyle changes you need to or should look at pursuing to prevent your disease from progressing or to prevent yourself from having something else happen in the.
So you said the key words to me, and that is a 10-minute consultation with your primary care physician.
Yeah.
So you're really taking what they've done at their primary care physician or whoever they're seeing, their allergist, and helping them integrate it better into their life.
Yeah, and to understand it.
Right.
And this is kind of jumping ahead a bit, but the thing that I love about you Define Wellness is that it identifies that the third party payers have sort of driven the healthcare system into a mess.
Yeah.
And part of that mess is, and I've been a part of this mess as a practitioner. You want to spend 30, 40, 50, 60 minutes with a patient to make sure that they really understand what's wrong with them. But you've got someone booked every 10, 15 minutes. If you're working in a clinic, if you're in a hospital, you've got, maybe 50, 60 patients you've got to go and take care of. Pharmacist in a community pharmacy, you're dispensing 200-300+ scripts a day, and the time just isn't there. So my company was established for two reasons. One, to bridge that gap. So to make sure that everybody, my slogan is to empower the best you. And I really feel that for people to be able to know what they need to know to empower their healthcare, they have to have the education. And so I'm there to supplement what they get with their practitioners. And then also, I'm sure we'll get more into later, I have a very large passion for alternative healthcare as well. So I feel that bridging those two is also important. And that's the other reason I established a business.
Right. And what you do typically is not covered under their medical insurance. So this is definitely an investment in themselves. Well, we're going to be amazed at how fast time flies. We're not at the end yet. But there's two things that I want to cover before we get to the end. Number one is you mentioned alternative and holistic providers, and how can you work with alternative and holistic providers who have a client or a patient that they're seeing? How would that work?
Well, I think, the approach that I always have to anything is that, and really what sort of another factor that drove me to make my business is that I realized I wanted to help people with the holistic approach. But I can't learn every modality of care. But I have a lot of beautiful people around me that know it.
Mm-hmm.
So as much as I want to educate my clients, I would like to be educated by the practitioners that you have on your network, so that
Cool.
I know in my practice, whenever, or in my business, when I have someone that comes to me, I
Mm-hmm.
want to know, and they say, you know what, I have anxiety, we'll say, and I'm not really wanting to go and get on a medication. Well, I want to know every type of modality that there is available to them that I could send them to. And vice versa. I would love to share what I have to offer in my business so that the providers in your network are also able to potentially send them.
Cool.
And that's how I feel like it works best.
So let's make the big announcement.
Let's do it. I'm
Yeah,
ready.
yeah,
I'm ready.
I'm ready too. So, if you guys can't tell, Brett and I have talked about some things to help him learn about all the different modalities and be a better service to the alternative and holistic wellness community as a whole. So, Brett, why don't you share your vision as to where we're going?
I would love to. I think I've already kind of started the conversation. I believe, and Denise has posted this in a few of the things in the Facebook group. If you've been watching, we want to. My vision of holistic care is not what's traditionally seen. To me, holistic is WHOL. Holistic. You treat the whole person, mind, body, soul, spirit, and that includes Western medicine, alternative care, naturopathic, whatever modality of healthcare there is. It's up to the patient. What do they want? You define wellness. Let them define what they want, and let us as providers know the breadth of what we all have to offer, and let's help them find it. And let's blend together and be holistic. So that's how I view it, and I am so thankful to have met Denise and be a part of this company, because I think that this is the platform to really make that happen and change the conversation in the industry.
So the conversation, just so everybody, you didn't get to the part that I thought you were going to get to.
Oh, well, I can keep going.
Keep going.
Narrow me down.
Yeah.
Narrow me down. Which would you?
Okay.
So go ahead.
Okay. So what Brett's going to be doing is that we're going to be doing some of these like the Apple a Day webinars, but it's going to be between Brett and an alternative and holistic wellness professional to get on one of these talks and talk about what you do in alternative and holistic care and what Brett does and how to bridge that gap. And they'll be facilitated also by me. So we will be looking for wellness professionals who want to raise their hand and say, hey, I want to be a part of that conversation. It's going to get you some great business exposure, particularly when it's posted on YouTube for all the world to see. And the title of it is Making Holistic Holistic. So
yes.
Making H holistic, W holistic.
Yes.
And so we will be launching these very soon. We just have a few details to work out, like when are we going to do them? But it's really a matter of we'll schedule them when wellness professionals are available. And so it may not be on a set date and time. It may be on a set date and time. We're letting Brett take the lead on all of this. So this is really an exciting thing. I think it is a great step towards helping the individual, the consumer, the patient, the client better by broadening everyone's perception and finding out that a pharmacist is not a mean, nasty person who prescribes drugs. So that's kind of...
Not always, no.
Yes.
Not the reformed ones.
So I do want to give the opportunity to those who are on this webinar live to ask any questions of Brett that on any range of topics. So if you have a question, feel free to type it into the chat box or unmute your phone and feel free to ask a question. Now is your time. It sounds like we've done a really good job.
Yeah, everybody knows what's going on. That's beautiful.
I guess, oops, we have, yes.
Yeah. Well, I like what I'm hearing, and I like the idea of having that interview to better discuss how the different modalities can be integrated with traditional Western medicine to help clients, help patients. I've always thought, what we do is alternative medicine. It's complementary medicine.
Mhm.
And so if you can imagine that a doctor gets a patient and the patient has a problem that might require some medicine, some chemicals to treat initially, but we kind of understand that many things that people go to doctors for is rooted in stress. It's rooted in things that have happened to them in their life. It's gone on and on and on. And of course, that produces chemicals like soup in your body, which then affects different organs and so on. And now you have a disease. So I do believe working together, we could use many different modalities, pharmacy, traditional doctoring, and whatever alternative medicines to treat patients. This is probably a heresy, right?
We like being change makers, Robert.
We're disruptors. We're disruptors.
Right.
And Robert, I think that's a beautiful way to look at it. It's and that's certainly the foundation of why I have my company. I'm trained in Western medicine, and even and I can sort of advocate for or at least my school in Kansas City. I can't for all schools, but my school doesn't teach anything negative towards alternative medicine. It's just simply, and this is true to anything for anyone, we don't really recommend things we don't understand because we don't know that they are or are not going to work. And that's why I'm very thankful that I've been able to get on this call to tell you all, come educate me. I know I've done a lot of research on my own. I'm actually Reiki session in about 2 hours today. And there's so many other things that I've learned throughout my own research, but with a network of, Denise, I think it's 400 providers that you have?
We have 220-ish locations representing about 450 to 475 wellness professionals.
450 individuals. I know that there's so many things out there that I haven't even heard of, and I want to know it all. I want to be able to help bridge that gap, be the Western medicine sort of advocate for our network to say, hey, go to my colleagues who are physicians or physician's assistant, pharmacists, and say there's a group of really amazing people that can do just what you said, Robert. You're finding patients that you don't really know what to do for them with a drug, and you think that maybe a drug's not needed. Maybe there's something else that can help calm them down. There's so many things that are available, and I think it's just a matter of educating, cross-educating, and getting everyone to know what we all do in the sandbox.
There is one factor, that we found, those of us that practice what I practice, is many of the traditional, psychotherapy, the way they operate is, they get a client in and then they have that client for weeks and months and sometimes years. And so that's a steady income. This is pretty blunt, okay?
Yeah.
When we work with clients, we might work with them 3 or 4 times and that's it, they're done.
Yeah.
That's not a very steady income.
Right.
But we understand that there's no shortage of people with problems.
Yeah.
That's right.
Okay. And so the idea is once the word gets out, I can go see Robert and, after 3 or 4 visits, I'm at a point where I can actually work on myself. All the big stuff is gone. I no longer need to take drugs. I no longer need to go make weekly visits to my psychotherapist, etc. That's where we want to go.
Yeah.
But this is the whole idea. The traditional psychotherapy, that would be my counterpart. I think they don't want to hear that because they're not going to have long-term clients.
And I think, I definitely think that's a component of it. And Denise and I have discussed it a bit. And it's all about, that's why I'm very passionate about what we're doing, because I think it's just a matter of us all getting together in some forum and educating each other so that we know that you aren't trying to go and steal any type of business. We all have the same goals here. We have clients, patients, however you refer to them, and we want them to be healthy. We want them to be, prosperous. We want them to be empowered. That really should be the goal of any practitioner.
Mm-hmm.
And I totally understand. We all can understand the need for income and for business, but like you said, there are plenty of people that have problems. And so how many people do you have that might need a psychotherapist? And you could cross refer, to a psychotherapist when you have a client that might be in need of that. So I think if we start changing the conversation where it's not a divisive industry, but we are all fluid and start to marry everything into one sector, that's going to really change that conversation, because there's no longer going to be a fear of alternative medicine is stealing from Western medicine and Western medicine is stealing from alternative medicine. That's the conversation I want to change the most, because we can all work together. And sometimes there may be a client that needs you both at the same time. Maybe they need you in February, and then in March something happens where they need the other person in March, and it bounces back and forth. I'm not sure exactly what it looks like, but I know, to give you an example of my personal opinion, a patient who has cancer. I actually have a friend of mine that is utilizing both Western medicine for treatment of her very aggressive type of cancer, but she wants to minimize the amount of Western medicine that she has to use as much as possible. And I support that. If she can go to any other type of alternative care practitioner to help her reduce her stress, if there's, she's actually found a couple of modalities that are helping her with her nausea, where she's having to take her medication for nausea maybe once a week, which is fairly unheard of with the type of treatment that she's doing. That's what I want to see, is where we don't have Western medicine dominating something, and we also don't have alternative or naturopathic care dominating something. We work in synergy to make sure that our patients and our clients are healthy, and we're getting them the care that they want. What do they want? If they want all Western medicine, that's their decision. If someone comes to me and says, I don't want a drug, that's my cue to educate them on what's available, but then ask them, well, what do you want? I want something that is more alternative. Well, having met and been educated by our network of providers, I can then start saying, okay, well, I think it's good that you get in touch with Robert and get in touch with this person and this person. Explore your avenues. Mm-hmm. I think it's really about listening to what the patient wants. And I know it might sound a little mushy, but I really believe it. Let's listen to them. Let's educate them on what their options are, and then let them make the choice.
Yeah. You bring up a good point about cancer. I mean, my wife passed away from cancer, so I was a caregiver for 5 years, and I really understand all those things, and even the grief process and all that. But I understand that chemicals is part of, pharmaceuticals is a large part of the cancer treatment, the cancer process. But it doesn't do anything for the emotional component.
That's right.
It doesn't do anything for the emotional component of the caregivers and the friends that suddenly don't come visit anymore. Okay? And so if we can work hand in hand, a doctor provides prescribes the chemicals to help treat the disease, but we know what the end result is going to be, okay? And so we need to do some emotional preparation for that event, okay? And so we can eliminate all the triggers and all the negative emotions attached to this progressing disease. It just makes that portion of the life so much easier to live through.
Absolutely.
The caregivers, because the caregivers, they end up talking about, oh, I coulda, woulda, shoulda, I feel guilty about this and that. We can work on them too. And as the caregivers feel better, it reflects onto the client, and the client feels better. And so it just makes that whole process go so much smoother. But again, it's an integration of the Western medicine and the holistic approach.
Yes, and making it WHOL, holistic. That's right.
Well, I think I know who your first person to interview is.
You're right. I think we'll be contacting each other soon too.
Absolutely. Okay. So in the interest of time here, because we could be here all day talking, and you're going to want to listen to us all day probably. But what more would you like to add, Brett, that we have not covered?
Well, I think that I think I've said the majority of my, to kind of summarize it all up to end. I'm really passionate about what I do. I'm really passionate about what you all as providers do, and I am very excited to learn what you have to offer so that I can start integrating you into my business. And I really think that it's going to take a lot of work, and it's really going to be a movement. It's not going to be just a change of conversation. It's going to be a movement, and it's going to happen. It's going to happen. I'm very headstrong, and Denise is too. So I'm very thankful to have found her, to have found this network of providers. I believe in all of you, and I really mean that. And I don't exactly have all the details of how we're going to make this happen, but I need your support and I need your education. So find me, talk to me, let me know what you do, and let's figure out how we can work together to change the conversation and make the movement.
Well, that's a perfect segue to how to find you. So I am sharing right now the You Define Wellness website, and I have actually clicked over to the provider directory so that you can, those who are watching this can see it, and all you have to do is put the name Brett in the quick search field, and that's going, if you scroll down, it's right there, and his profile will come up. So Dr. Brett Courtright, you will find him there, and check out our website while you're there. Nose around. We've got some exciting things that we're doing in terms of bringing an employee benefit program to employers so that they can, their employees can access alternative and holistic healthcare. So, Brett, thank you very much for being with me today, as well as those who are on our conversation live. And I appreciate each and every one of you who has taken the time to watch this video, and feel free to engage with us. That is what we are here to do. So thank you for being with us today.